Today's video that I'm presenting to you is about unlocking fertility potential naturally. Now, when I say to unlock things naturally, it doesn't mean we're anti-Western medicine. In fact, I do support a lot of women that are going through IVF. So I want to explore with you evidence-based holistic tips to enhance the fertility journey. Fertility is a deeply personal journey, and I want to be here to be supportive no matter where you are in your path, every step of the way. These are the top 10 tips that I use with women and my clients to help them to get pregnant, whether they're doing IVF or a holistic journey 100%. So tip number 1 is nutrition, focusing on nutrition. So this is crucial, and sometimes this is difficult for some women to follow, but a balanced diet is the foundation of fertility. It helps gut health. And we want to focus on whole foods that are rich in vitamins, minerals, and antioxidants. Specific foods like wild-caught salmon, dark leafy greens, beets are good for blood, berries like blueberries, strawberries, and then there's other nuts that can boost fertility. Any food that you eat should be as clean as possible. You can do it with organic foods, and if you don't have access to that, then getting a vegetable brush and lightly brushing everything off and washing them, because that makes a big difference, because you don't want to be eating any toxins, especially when trying to get pregnant. Tip number 2 is stress management. High stress can negatively impact fertility. You want to work in practical relaxation techniques like deep breathing, meditation, and always prioritize self-care to reduce stress levels. So to go into that a little bit deeper, there are apps for meditation. I have meditation courses that focus on fertility and women's health. Something as simple as waking up and sitting by yourself in a quiet space and taking 10 slow, deep breaths, inhaling and filling your belly up like a beach ball, and then exhale out your mouth. It's not forced, but it's more like an observation of the breath. So that's a really good place to start with. Okay, next up is there's certain lifestyle changes that need to happen, and it really depends on the woman or the man. And it's crucial to acknowledge that if what a woman's been doing so far hasn't been working, that there needs to be a tweak or an adjustment in the day-to-day life. So things like maintaining a healthy weight, being overweight, being underweight, both of those can impact fertility health, avoiding smoking of any kind, and then limiting or totally eliminating alcohol consumption. It just depends on the person. Sometimes red wine can be a benefit, but not if you have allergies to the preservatives. So there's different things about it, and I would say there's different camps on whether any alcohol is good or not. Same with caffeine. Some people think an absolute minimal, but I think it's more about the quality of caffeine. If you've got caffeine that has, or coffee that has toxins in it, or not great growing practices, then that's a bigger deal than having organic or fair trade clean coffee. So there's different areas on this, but small positive changes can have a huge impact on overall fertility health. I have other videos on fertility diet, and that would include going over caffeine, alcohol. Next up is number 4, exercise and physical activity. It's good for everybody, but especially women that are focused on fertility health. Regular moderate exercise increases the odds of getting pregnant. Women want to aim for at least 30 minutes of activity most days of the week. And the most important thing, I can't tell you the most perfect exercise. The most perfect exercise is the one that you're willing to do, but more importantly, you enjoy it. And if you don't enjoy it in the beginning, that's something I can help you work on. But at least 30 minutes of activity. It's also good for stress reduction, but it's good for blood circulation. It's good for heart health. There's so many things that kick off once you start pumping the blood. Tip number 5 is focusing on proper sleep and getting rest. Quality sleep is essential for hormone balance for all women, but creating a sleep-friendly environment and establishing a consistent sleep routine or a schedule. What I mean by that is, I know when I was younger, I'm guilty. It's some nights I was up till 1, other times I was asleep by 10, other times I worked till 3, then I did overnight shifts. There's all these things. I work with a lot of nurses. A lot of my clients are nurses, and some of them do overnight shifts. It's tricky. if you're in that situation, then check the comments below. If you're like, well, this is a lot of information and it seems basic, but then I'm not really sure where to start, check the comments below and then just click the link and fill in a really quick few-minute application to have a discovery call with me, with no one else, with me. And then I can see where you're at on your path and then see if we could actually work together. And if not, I'm still going to help you in that discovery call to see if there's any red flags and see a good jumpstart point for you to improve your fertility health. And if you don't know who I am, my name's Dr. Gina Rosella Terranoni, and I've helped over 2,000 women and couples to get pregnant with holistic medicine. Whether they're using IVF or they want to go 100%, it's not an either or. I work with at least 50-60% of my patients in clinic and then online as well that are using IVF. And the best way to have a successful IVF outcome is to implement holistic medicine practices for preconception care, for womb care before you start medications. Just a thought. Check out that link. Okay, next up, supplements. This is tip number 6. Certain supplements can complement the fertility journey. So again, you want to be thinking about not reading everything on Google. There's so many fertility supplements and herbs that you want to make sure that you're taking what's right for you. There's so many things. There's inositol, there's CoQ10, there's omega-3s, focusing on nutrients like folic acid, vitamin D. Oh, gosh, I could list off another 15, but does that mean that you have to take off 15 or 20 supplements? Heck no. No way. That's too much on your gut. I would say the step before that is focus on the fertility diet, which again, I have several fertility diet videos and starter meal plans for that. Think about that first before you start dumping a bunch of supplements onto your gut, because the gut has to be able to receive what you're putting into it. Next up is tip number 7, hormone balance. So hormones play a crucial role in fertility, and balanced hormones, as we know, are a key to conception. So exploring hormonal therapies is necessary under the guidance of a doctor, but you can also do some of this with supplements and with herbal medicine, with acupuncture, with acupressure, and then I use patches to stimulate acupuncture points on clients that I don't have locally. So that's another option. Next up is tip 8, environmental factors. This is huge. You do want to minimize exposure to environmental toxins in your home, in your workplace, out in public, choosing organic products as much as possible, and reducing use of plastic so you can reduce exposure to BPAs. And I have an entire guide that will walk you through your house and take you room by room. You can just do one room a day and start seeing where toxins could be hiding, even in makeups, in soaps, in house cleaners. A clean environment supports a healthy reproductive system. And tip number 9 is mind-body connection, and this is similar to stress reduction. Mind-body connection is huge. Practice mindfulness, meditation, yoga to reduce stress, and this can enhance fertility. And there's more and more research coming out, especially with meditation and also mindfulness and yoga practices. Your mental well-being matters. It is crucial, especially on your fertility journey. Tip number 10 is I'm always going to recommend to not do it alone. You're not alone in your fertility journey. And it's really important to know that there's a lot of misinformation out there, and consulting with a healthcare practitioner, a professional that specializes in hormones and fertility health, such as myself, this is essential. And we can provide personalized guidance and support as opposed to dropping in on all the lists online. Just remember, you're not alone on the journey, and I'm really happy that you joined. Please check the comments for the call link, and if you have any questions, drop them there too. I'm happy to help.